Hi, Dr. Coons again. This is the second type of stretches I want to kind of go over. When a patient is a little bit more improved, then we can start focusing on the movements of the body. And I think the number one movement to start looking at is the movement of the hip capsule. So I like to stretch the front, the side, and the back of the hip capsule. So starting with the most basic of stretches would be the hamstring stretch. Now, obviously, when a patient is really hot and they're really in pain, this might not be ready for this. This might be something that as the patient starts to heal, we can start stretching the back of the hamstring, and the removal of that tightness, that chronic tight hamstring, can bring a big change in how somebody feels more chronically through the day. So the hamstring was the first thing we like to kind of start with. The second is the IT band, stretching the outer part of the IT band and also the piriformis muscle. So either a step over and stretch the outside part of your leg, and or the piriformis, where you maybe pull the knee up towards you while rotating it inwards towards your chest and pulling on that leg and giving it a good stretch right in the buttocks. That would be stretch number 2. And the third stretch, the big old quad muscle right in the front of the leg, just stretching in the front to push that hip forward and feel that quad get rid of some of that tension. Maybe even the deep hip flexor, the deep set of muscles there that are lifting your leg forward. If we can stretch the psoas muscle, then we can really be ahead of the game as well. So those three motions, stretching the back of the leg, the side of the leg, and the front of the leg, are what you really want to look at. So again, if you're having a problem you might think is a disc-related injury, give us a call. Let us help you. Let us sit down and find out what set of events we can put into play for you to get you back to living your normal life. All right, thanks. Dr. Kuhn signing off.